Pruritus? What is a pruritus? Pruritus is an unpleasant sensation that provokes the desire to scratch. In veterinary medicine, this sensation is impossible to differentiate from burning since the animal's responses to this stimuli are similar. Pruritus should be regarded as one of the 5 primary cutaneous sensations like heat, cold, pain, and touch. So, pruritus is an epidermal sensation, whereas pain can also be perceived from a denuded skin. So, I have here a drawing of a skin showing its epidermal nerve endings in a denuded area. If these epidermal nerve endings will sense a pruritic stimuli, the pruritic sensation will then be carried into the small unmyelinated C fibers, or what we call the axons, into the ventrolateral spinothalamic tracts via the thalamus into the cerebral cortex. There are certain areas of skin which may have increased number of itch receptors or are more sensitive to pruritic stimuli. Although fewer nerve endings are present in the chronic dermatitis skin, those present have a lower threshold for pruritic sensation. For many years, histamine was believed to be the major pruritogenic substance, but it is now believed that proteolytic enzymes are the major mediators of pruritus. These proteolytic enzymes may be released from bacteria, fungi, mast cells, epidermal cells, leukocytes, and capillary dilatation. Although pruritus is a common feature of allergic skin disease, many other diseases cause pruritus through the release of proteolytic enzymes. There are certain conditions which may actually potentiate the pruritic sensation, such as boredom. Boredom increases the cerebral response to a physiologic itch stimuli and actually convert the sensation to a pathologic state. Therefore, the dog scratches itself for temporary control to relieve pruritus, which is a primary physiological response. This pruritus is frequently associated with several primary skin lesions, and this includes papule, pustule, vesicle, and hyperemia. Secondary skin lesions observed include scoriations, scales, crust, lichenification, and hyperpigmentation. The nature of these lesions, their distribution, pattern, and the degree of pruritus are very important factors to consider in the differential diagnosis of dermatologic conditions. In diagnosing these dermatologic conditions, there are at least 5 basic questions in taking the dermatologic history and physical examination. 1. Is it pruritic? 2. What are the basic skin lesions? 3. What is the distribution pattern? 4. Is it contagious? And 5. Are other body systems involved? These are the expanded database for the pruritic animal. 1. Microbiologic tests such as fungal culture bacterial culture. 2. Immunologic risk procedures such as intradermal skin test and direct fluorescent antibody. 3. Histopathology. 4. Provocative exposure to environment, diet, and drugs. Both local and systemic medications may be used to decrease pruritus. In local therapy, use of cool water baths, cooling and drying agents such as camphor and alcohol, weak acid solutions or the astringents such as salicylic acid, tannic, or acetic acids. Lastly is radiation therapy. This may also relieve pruritus in localized lesions. In systemic therapy, this is the administration of glucocorticoids, antihistamines, centrally acting antipruritic agents, serotonin antagonist, and megestrol acetate. Glucocorticoids are very effective antipruritic agents and are anti-inflammatory membrane stabilizers that decrease the effect of proteolytic enzymes. The centrally acting antipruritic agents, such as trimiprazine and hydroxyzine hypochloride, thus are phenothiazine tranquilizers that may decrease the awareness of pruritus. The serotonin antagonist, such as cyproheptadine, with the marginal antipruritic properties in dogs and cats. And lastly, the megestrol acetate, which is a progesterone-type drug and has an anti-inflammatory and subsequently antipruritic activity in cats. And that's the end of our Pruritus. Thank you for watching!